Hi everyone, welcome to my channel. In this video we'll learn about platelets. So platelets are non-nucleated cells. They are oval to spherical, 2 to 4 micrometer in size, 5.8 femtoliter volume. They are colorless and the normal count is 1.5 lakh to 4 lakh per mm cube. Lifespan of platelets are 8 to 12 days. They contain Golgi apparatus, mitochondria, ribosome, endoplasmic reticulum, microtubule, granules and canaliculi system in contact with extracellular fluid. Platelets have granules which are alpha granules and dense granules. Alpha granules contain 50 to 80% are alpha granules. Basically they contain platelet derived growth factor, platelet factor 4, fibronectin and thrombospondin. Dense granules contain serotonin, calcium, ADP and ATP. Membrane of platelet, if we see, it's 6 nanometer thick, large amount of phospholipids and it's coated with glycoprotein which prevent adhesion to normal endothelium. Okay, and platelet membrane has receptors for ADP, P2Y, P2Y2 and P2X1. For VWF, von Willebrand factor. For collagen it is having receptor, for thrombopoietin it has receptors, for fibrinogen. These are target for drugs and in MI also involved in temporary plug formation. Okay, so the basic idea is platelet has hemostatic function and non-hemostatic function. The major function which we can't leave, that is temporary plug formation, and temporary plug formation is how basically platelet is exposed to collagen and it attaches to VWF factor. VWF factor attachment of platelet lead to platelet adhesion which lead to platelet activation and which releases ADP and fibrinogen factor and VWF factor. Because of release of these three factors, platelet can adhere to other platelet and which is kind of leading to platelet aggregation. If you want to see with structure whatever I have said here, you can visit my blood clotting video. Okay, so that is basically how platelets are helping in formation of temporary plug. Okay, so here we are talking about only platelets. Some structural peculiarities and then function, hemostatic function and non-hemostatic function and various variations of platelet count. Okay, so function, role in hemostasis, platelets are involved in arrest of bleeding as we have seen by forming temporary plug, okay, which is basically assessed by bleeding time. Fine. Then it accelerates clotting. It releases platelet factor 4 which form clotting factor 5-11. It releases 5-HT for vasoconstriction at site of injury. It is having role in clot retraction. So what is that? Basically serum ooze out once permanent clot is formed. Okay, serum basically oozes out and clot become 1/3 of its size in next half an hour. Platelet attract to fibrin and pull it closer and serum ooze out from it. So basically that is the permanent clot. Okay, which is called clot retraction. So volume of clot become less and it basically having a permanent seal. Okay, so these are all about hemostatic function of platelets. Now let's just touch upon non-hemostatic function of platelets. So there are various function of platelets which are not basically related to blood clotting. That is storage and transport. It store 5-HT stored in platelet which is released during injury for vasoconstriction. Then phagocytosis, it's having mild phagocytic activity, and the major thing is in research it has been shown to stimulate neutrophils via various receptors for phagocytosis process. In inflammation, by releasing various inflammatory mediators it helps, and then endothelial repair, it basically release platelet derived growth factors which is helping in angiogenesis. Role of platelet granules is found to be alpha granules which is found to be procoagulant, help in clotting. Fibronectin which stimulate platelet aggregation, thrombospondin which stabilize the plug, and PDGF for healing of that vessel. Dense granules have various ADP, serotonin, lysosome have acid hydrolases, microperoxidases which help in ultimately phagocytosis and killing of the microbes. So that is about non-hemostatic function of platelets. Now let's see about variation of platelet count. So normal count is 1.5 to 4 lakh per mm cube. So less than 1.5 is basically reduced platelet count, and more than 4 lakh is increased. Increased platelet count is called thrombocytosis. Physiologically, it can be because of exercise and at high altitude. And pathologically, more than 8 lakh, we call it pathological thrombocytosis because of gene mutation in blood or bone marrow, because of splenectomy, because of massive hemorrhage, infection or inflammation. And thrombocytopenia, which is reduced platelet count, which can be fatal because it can lead to bleeding, less than 1.5 lakh per mm³. Physiologically, they are less in newborn females. With age, they reduces during menstruation. And pathologically, for example, production is decreased, like in bone marrow production is decreased, which can be because of bone marrow depression, because of various drugs, radiation exposure and aplastic anemia, right? Then we have various leukemias and dengue. During dengue, which is very important, which you can't leave during viva, dengue fever, where thrombocyte count reduces, right? Then we have purpura, which is both type, thrombocytopenic and athrombocytopenic, which can be because of capillary damage, right? So thrombocytopenic purpura, in which platelet count reduces. And these are all which are basically because of reduced formation. What if destruction is more, not formation? Destruction is more, so which can be because of spleen. So hypersplenism. So splenomegaly, large size spleen is there, which is basically causing destruction of spleen, platelets. Then we have DIC, disseminated intravascular coagulation. There are various drugs, thiazide, estrogen and autoimmune disorders, which might be linked with increased destruction and thrombocytopenia. So that's all about platelets. Since we are talking about clotting, so let's just see the name of natural anticoagulants and synthetic anticoagulants. So natural anticoagulants are heparin, which is released from liver, basophil and mast cells. Okay, then antithrombin 3, which inhibit thrombin formation, inactivate various clotting factors. Protein C, which is fibrinolytic. Protein S, they are naturally present in our blood, right? In salivary gland of leech, basically hirodin is present, which is anticoagulant. Anaphyllin in mosquito. Fine. Synthetic ones are EDTA, ethylene diamine tetraacetic acid, EDTA, a synthetic anticoagulant. Various oxalates, which are having calcium chelating property. Okay, then sodium fluoride and warfarin, which is basically oral tablet, which inactivate vitamin K. Vitamin K, why? Because vitamin K is helping in synthesis of factor 2, factor 7, factor 9 and factor 10. So this is all about platelet, clotting and anticoagulants. I hope this video is helpful for you. Please subscribe my channel if helpful. Thank you so much for watching. You can comment below if you want any other video. Thanks for watching, guys. See you there in next video. Bye.